Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Last week, comedian Whitney Cummings described her journey with migraine headaches, a condition that's plagued her for years and that affects 39 million people in the United States. Many other celebrities suffer from migraines, including Ben Affleck, Jackson, and Serena Williams. In today's episode, I'll tell you what you need to know about migraines and the warning signs that should prompt immediate medical attention. Let's get started. Whitney Cummings, co-creator of the CBS sitcom Two Broke Girls and creator and star of her self-titled NBC show Whitney, considered her constant migraine attacks a part of life, which were out of her control. When she finally managed to treat her debilitating pain, she was shocked to discover that most people, quote, just move through the world without a throbbing head. As an addiction medicine doctor, I found it interesting that she compared her relief from massive migraine pain to an opioid. A further reminder that opioid painkillers like oxycodone, Percocet make everything feel better in the short term. So what exactly is a migraine and who gets it? A migraine is a type of headache that can cause severe throbbing or pulsating pain on one side of the head. According to Harvard Health, there are over 300 types of headaches, but the most common primary headaches are tension, cluster, and migraine headaches. There are also different types of migraines, including migraines with aura, or complicated migraine, migraine without aura, or common migraine, hemiplegic migraine, i.e. temporary one-sided paralysis, and chronic migraine that occurs at least 15 days per month. So who gets migraines? 12% of people in the United States have this neurological condition, among whom 75% are women. So what causes migraines? Doctors don't know the cause of most headaches, but they know it's not the brain tissue or skull because they don't have nerves that detect or signal pain. But blood vessels in the head and neck, tissues surrounding the brain, and some major nerves originating in the brain can signal pain. Migraines can be triggered by several factors, including stress or anxiety. According to the Cleveland Clinic, during stressful events, the brain releases certain chemicals that can trigger a migraine. This is the fight or flight response. In Whitney Cummings' case, a neurologist identified that her anxiety about getting a migraine attack was actually provoking them. Other migraine triggers include caffeine, bright lights, missing meals, and hormonal imbalance. So what are the symptoms of migraine headaches? Symptoms correlate to 4 phases of migraines. First, prodrome symptoms include difficulty speaking, reading, sleeping, and concentrating, nausea, food cravings, irritability, depression, and muscle stiffness. Number 2, aura symptoms include numbness and tingling, speech and vision problems, temporary vision loss, and one-sided weakness. Third, headaches. Symptoms include neck pain and stiffness, nasal congestion, nausea and vomiting, sensitivity to light, smell, and sound, and depression and or anxiety. And the fourth phase, postdrome. Symptoms include depressed mood, euphoria, fatigue, and difficulty concentrating. Other migraine symptoms include loss of appetite, pale skin, sweats, chills, and a tender scalp. So how are migraines treated? While they can't be cured, migraines can be managed and even improved. Two main treatment categories are abortive, So these medications reduce pain and are most effective when taken at the first sign of an attack. They include ibuprofen, aspirin, and acetaminophen, i.e. Tylenol, as well as triptans like sumatriptan or Imitrex, verapamil, propranolol, amitriptyline, topiramate, i.e. Topamax, and hormonal treatments like estrogen or contraceptives to treat menstrual migraines. Whitney Cummings uses an IUD to manage symptoms. And then the second category is preventive or prophylactic medications, which may be prescribed when your migraine attacks are severe, occur over 4 times a month, and are significantly impairing your day-to-day life. They include beta blockers like atenolol, antidepressants like duloxetine, and anti-seizure meds like valproate. Whitney said that taking medicines to reduce her anxiety was a, quote, game changer. Lifestyle changes and home remedies can also provide relief from migraine pain, many of which Whitney implemented, such as regular eating, exercise, and a sleeping routine, staying well hydrated, and a cool cloth or ice pack on your forehead, and relaxation techniques like deep breathing, meditation, and yoga. So what are headache warning signs? Call your doctor or go to the hospital if your headache is unusually severe, increases with coughing or movement, gets steadily worse, is accompanied by a painful red eye, occurs after a head injury, or first appears after age 50. You should also seek medical attention if your headache is associated with fever, persistent nausea and vomiting, stiff neck, confusion, memory problems, or other neurologic symptoms like vision problems, slurred speech, weakness, or seizures. So, how can you get involved? Learn more about migraines and headaches from trusted sources like the Mayo Clinic, Cleveland Clinic, or Harvard Health. You can also learn more and donate to foundations dedicated to migraine research like the American Headache Society and the Migraine Trust. Well, that's all for today. Here's your joke of the day, headache theme. What did the wheat farmer say when his crops flooded? Ah, migraines. Tune in Friday, 3 p.m. Eastern for my next installment of Dr. Roy on the Road, when I'll ask folks on the street about mental health. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.